Good morning. You're welcome to our today's lecture. Where is the okay? Is it a permanent matter? Why is it not clean? You're welcome to our today's class. Today we'll take a look at Ability 151, Introduction to Laboratory Techniques. Today date is what?
26.
You're welcome. You're welcome to the first class. Your first class in Dispensing. 224/2025 training session. I hope you've gone through the material, the course material I sent you. Time waits for nobody, so go through the materials. Today's class is going to be an introductory class. Today I will share with you, I will let you know what you expect to see in the course, to cover in the course, and what I expect from you, so that you'll be able to lay a solid foundation on dispensing. If you get it wrong in this course, you have issues with dispensing. And dispensing is a very important course when it comes to pharmacy. Without dispensing, there is no word pharmacy. Am I communicating?
Yes, sir.
So you take it seriously. You take it seriously. Based on the curriculum for the course, you're going to cover the following topics. The material I sent to you, the topics there is based on what you have here in your what curriculum. Are we together?
Yes, sir.
So first of all, we look at the definition of dispensing. We will look at the definition of dispensing. During your orientation, you will be things concerning your GP, how to calculate your GP, and the credit units, how to use the credit unit in calculating your GP, and everything that has to do with all the courses you cover. You will be duly introduced. So am I communicating? So I don't want to start going into that. My focus is on what? The course. Are we together?
Yes, sir.
So, but let me just use this as an example now. This is BDT. Are we together?
Yes,
This talks about what basic dispensing what POE, basically. This is just the abbreviation of the course. This is the code. This one here means that it's 100 what level first year. Any course with CBI, one something is the first year course, 100 level course. When you go to second year now, you see 200 BDT, 25, 251, 252, 253. It means what? Second year courses. Are we together? You also see BDT 35. So what it means that it is a 10-year what? This 5 here talks about the stress, how these courses are graded based on their importance in particular what course. Am I communicating? So these 5 tells that this course is a very, very great important when it comes to this particular what discipline. I will put together. That's why you see something like it's not that English is not important too, but you see English 1 see that zero in between. It's not that it's not after all. English is the medium of what communication, right? But when it comes to, it's not when you ask to dispense or you start speaking English, you will dispense it. I'm not communicating here. Here, you talk about the stress. You see, if you take all the courses you offer in this school, five is the highest number. Am I communicating? 5 is the highest number. It shows that this is very, you cannot do without it. There's what we call AEM, is AEM 1, 2. The stress there is just 2. Not that it's not important to, but at least to compare with this, I'm not communicating. Now, this, the last digit talks about the what? The semester. If it is an odd number, is first semester. What it means is that it's the first semester course. You want to see an odd number there. That's the implication. Am I communicating? Now, if it is an even number, it's second semester. That's why in your second semester, there's another course on ability you will do. We call it ability 152. Once you see this, what it means that this course, the extension of this course is second semester. Even number tells us about second semester. Am I communicating? When you go to your second year now, you start seeing BBT 251 for 200 level, stress, and the first semester. You also have BBT 252, second semester. You also have BBT 253, first semester. This one is pharmaceutical calculations. First semester. It's an odd number, so it's first semester. You have BBT 254, logistics in second semester, 254, second semester. You also have BBT 255, first semester. Am I communicating? So that's the meaning of the source. So you understand that, so that you know that it is not just each of these numbers mean what? Represent something, okay? So the course code for this course is BBT 151. The title is what? Basic Introduction to Laboratory Techniques. That's the title of the what? The course. Am I communicating? Now, so when you do your orientation, you will be everything out. The credit unit is what? 2. The credit unit of the course is what? 2. This credit unit is of utmost important when it comes to your what? GP what? Calculation. Don't worry yourself for now. Most likely is going to cover topics and know them. If you know them and score A, but if you know how to agree with that, and you're scoring nonsense, is it of any use to you? It's not. But for now, let me focus on the when we do your orientation, we explain this, okay? Let us not waste our time there. Just know that the credit unit is what? 2. And just know that if the next I show now, you are going to cover all your courses. You're supposed to know all the topics in your courses. But let's assume when it comes to in a situation whereby you need to devote more time to a particular course, it's important to it's very important to devote more time to a course that have higher credit units, because the more the credit units, the more the cost load is more. You see three credit unit course, you see the outline, you see the cost content is more than the one that has just 1 or 2. Am I correct? So what it means is that you devote more time. You share your time. Am I correct? By proportion. Devote more time. Let's assume that you study a course, let's say once a week. Try to study the one that has more credit. Let's say this one now. Try to at least 2 times in a week. You want to have 3, at least 3 times in a week, so that you will do what? Cover. Because if you like store AAA in one credit cost or two, and you are storing CCC in 3 credit, it will affect your what? GP. Am I completing? So don't worry, this thing will be explained to you more when you come to your when you come for your orientation. Okay, so let's go back to the course content, because I'm planning. I said that the first thing we are going to cover here is what? We look at what? Definition of what? Dispensing. We will look at definition of dispensing. We look at the scope of what? Dispensing. This is according to their cross material. That material is prepared based on this sequential, okay? So I just want to mention them. We look at the definition of what? Dispensing. Then we look at the scope of what? Dispensing. And the dress code. Dress code both in class and in your dispensing practical what? Laboratory. Am I communicating? Yes. So these are what we look at. We also look at the equipment used in dispensing lab. Equipment used in what? Dispensing laboratory. Under that now we look at what a laboratory is. Then we now go to the what? The equipment used in what? In dispensing lab. Then we look at reference books. We look at what? Reference books. So after that now, we go over to the fundamental operations in compounding. Fundamental operations in what? Compounding. Because dispensing is all about compounding, formulation, and what have you. Very important. So we look at what? Fundamental operations in what? Compounding. After that, we look at the weight techniques using different types of balances. Class A balance, class B balance, electronic balance, and what have you. Then we look at what? Calibration of bottles and measurement of liquids. Calibration of bottles and measurement of what? Liquids. So these things I'm calling out now, I'm calling out the fundamental operation, those operations in what? Compounding is what I'm calling out now. Weighing, weighing, measurements of a liquid. Am I volume? So we also look at clarification, according to dissolution, mixing, size reduction, size separation. These things are operations in the what? Under what? Compounding. Because if you want to compound, there are operations you carry out. Am I communicating? We call it unit operations. You carry out for you to be able, even if you want to cook, there are operations you carry out, right? You will some you grind, right? You grind them, right? Some ingredients you grind, right? Some ingredients you will cut, right, into pieces, right? Some ingredients you will sieve, right? Right? Good. You pick your rice, right? This is an fundamental operations to be able to help you prepare a wonderful what? Meal. A sumptuous what? Meal. Am I communicating? So the same way now, in compounding, there are different what? Steps. Operations. So that's what we mean by what? Fundamental operations in what? Dispensing. So after that now, we look at identification of dosage forms. We look at different dosage forms and how to identify them. Because drugs comes in different what? Dosage forms. Some comes as tablet, some come as a syrup, some come as a mixture, infusion, and what have you. But basically we have four categories of what? Dosage forms. We discuss all these things. Now, we now look at what? Identification of containers and closures for dispensed product. This product you have produced, you have manufactured, you have compounded. How do you package them? What type of container are you going to use for each of them? You don't just use anyhow container. But there's a container you use, it will affect the product. It will either contaminate the product or the product will some harmful ingredient material used in producing the container may enter your what? The product and cause harm to what? Their what? Patient. So this is what you look at. Types of containers and closures. When you say container, this is a container now, right? This is a container. And this is the what? Closure. The type of product there's a product that will be here to destroy this. Are you aware? So these are what I'm going to learn under what? This topic. Okay, so that's where the course will end. And we expect to finish this thing before the semester runs out. Are we together? Any question? Any question? No question. Now, apart from this is the course content. Another thing I want us to look at is what? Grading. In my course, I don't want, if you come to my class, if you take my class seriously, you have no reason at all to fail my course, any of my courses, if you are serious in my class. It's not the best of the best. It's not the best in terms of IQ, intelligence. It's not the best that's come out the best in my class. It's the what? Those that are what? Dedicated. You can still have a very high IQ and you are what? Committed and serious. You will come out the best. Am I comfortable? But if you have high IQ and you're not serious, you will fail my course. It's as simple as that. What it is that you try as much as possible not to miss your classes. If you have any questions to ask, feel free to do what? Ask. If you give any assignment, take it seriously. If you have any quiz, take it seriously. Don't miss any of them. People that fail my course fail it out of what? Carelessness. It's not because they don't know it or maybe good afternoon. Maybe it's just carelessness. Maybe distractions. But once you come to my class and go through my material, you do well in my course. And remember I told you that I will be having, okay, I don't think I mentioned that. Quizzes. Our quizzes will come in every week. Our quizzes every week. You may be online. How together? It mustn't be what? On site here, okay? Maybe online. So we just get ready for it. Weekends. So at the comfort of any place you are, you can do what? Write the quiz. It's just to what? Prepare you, continuously assess you. It's more like giving you assignment to them. Remember, but this one I want you to do what? Answer it and submit online. Then, as you submit, you see your score immediately. If you are doing well, if you are there. I will not be able to see whether you are looking at your material. If you look at the material, you're on your own. I will not be able to watch you. But I wouldn't advise you to do that because if you do that, it will affect you. A time will come when the time comes, you think that you know that thing, but you're not prepared. You are busy looking at your material. So, but the most important is that every week we have our quiz every week till the final day. Remember, you are missing this exam comes in the middle of the semester. So basically, we have the 100%. Okay, you have around total obtainable score, the highest obtainable score for the course is 100% as usual. The other here, everything that has to do with continuous assessment is what? 40%. Are we together? Why everything that has to do with what? The main exam is what? 60%. Why everything that has to do with the main exam is what? 60 what? Percent. So here, this is your exam. Of course, your exam on a normal is 100 MCQ. You know what MCQ is? Multiple choice question. The one you call OBJ. 100 MCQ. And there what? 4 theory questions to answer 2. This is everything here is we will be what? Bring that to what? 60%. That's the exam. Here is your continuous assessment. Everything here. This is also divided into 2. 20% of this is your what? Mid what? semester examination. So here, the remaining 20%, this is where you have all the quizzes you'll be writing. All the quizzes you will start writing from this weekend. What is weekend? All the quizzes. Are you afraid? All the quizzes you start writing will be compressed to what? 20%. As usual. Those that were here, last year, know what I'm talking about. Everything will come back to what? 21%. This year, this semester. So that means what if you start from the beginning of the semester, day one, and take it seriously, as far as I'm concerned, if you start from day one and take everything you're doing seriously, if you do well in this 20%, if you do well, I didn't say copy and paste. If you truly wrote the quizzes yourself, you read and wrote solely because I will not be there. You know, it's just an assignment anyway. But I want you to write here. I want you to copy and come and there. Copy and come and watch. So me, so that if you go assignment, they will write on this. They will copy all everyone will copy something and come and submit. You are really something. It is annoying. You come and so but this quiz, our advice, don't go and look for your classmate that knows it. You go and see by his side. If he shades A, if you tick A, you tick A, and you are advantage. You may get through here and still get nonsense here. And come here and get the worst of nonsense score. So try and make that this 20% here. Try and that you study. To reason that you be able to write this 20% by yourself. Believe you me, if you able to write this 20% by yourself and score up to 15% after the whole competition, there's no way you can get anything less than 50 here. It's not possible. I assure you that. Those that were here last year, there's no way you can score below 50 here. And there's no way you can score below 70 here. It's not possible. This 20 you are seeing here, if you write it to yourself, if you truly study by yourself, and score to 15%, there's no way you can score. There's no way you can score less than 60 here. If you want to score up to 15, you will score 8. And the A is not 8 something. A is from 9 something up. Am I complete? Yes. Or call it a something from 8 up. You know, we have different, we have levels of A. We have super A, above 9 something. We have powerful A, those that are 8. Then we have left and you go, narrow A, 70. So, but if you're able to just try as much as possible that you study, to listen that this thing here, all these quizzes you write every weekend, you write it yourself. If you mistakenly go and be copying from somebody, sorry, at the end, you won't know it. Because at the end, you don't know what to write. Maybe they don't know you want to do what, right? So the idea is that you should do what? Study. Am I complete? Alright, so these are what you make up the 100% in the course. Any question here? We have discussed the course content. I've also discussed the mark distribution that make up the 100%. What it is that you should try as much as possible to so that you have in this life, in the world of today, in this Gen Z period, that data is life. After you are feeling fit, it's not the attachment for women. It's not your shoes and clothes should come next. After you are feeling one, what should come next is your work. Data. If you are serious, and it's not data for TikTok. It's not It's not for TikTok, it's for your studies. I'm not coming. And make sure that you have a good phone, not 1G, 2G phone. Make sure you have a good phone. Make sure you have a good phone that will help you be able to, be online and do something meaningful with your life in this Gen Z period. Make sure you have enough data. Don't, in fact, safeguard your data with everything in you. So because you make use of it more. Of course, before you know what's going on in the platform, you must have your data. True, of course. So now, these things that will be going on every, ensure you have data. And before you write the quiz, ensure you stay where you have network. Because that quiz, they are nothing like, because you read or you write a lot of, you write all the 20 quizzes. So they are nothing like, sir, let me like, no, once you miss it, you have missed that one. They are nothing like a sir. I wanted to submit, and I have to 8 p.m., no problem. Because if you are writing CBT in your exam, the network will go PM. That will not give you second opportunity. They give you second chance. So please ensure that you are prepared for it. That's why I'm giving this guideline on time, so that you will not complain when the time comes. Yeah. Normally I'll take the time. When it will be. That is Sundays anyway. But if there's anything I'll maybe to start out, if I will cover it. Just always go, always. Of course, for my personal, there are 2 platforms that you are there. You have one for my personal platform, you have one for the school. All the information regarding the course I have with that personal platform. I don't post. What I post here is what concerns every good lecturer that everything that has to do with my course. The course I handle, each of the class have their own. That's where I post it. That means stuff. That's where you do. Always check it for what? Information. If you don't check it, you'll be here one day. I will post information that you won't know.
But sir, I don't think you can be there of personality.
Huh?
I don't think you can there of personality.
Hello? Yes. Sorry. Now, so here we stop. Okay, I was talking about the courses, right? The quizzes and please. Sorry for the interruption. So please take it seriously. I don't like seeing my student failing my proper but before you can pass my course, you must know it. There's no money. Before you can pass any of my courses, you must know it. You must be in your flavors. It's not let me come and do it. So you must learn how to sit down and stop. Because one man, I'll give you everything you need to succeed. One man is precious to me. See one man, you must earn it. You must earn 0.5 months. It's not free. Am I correct? So you must earn it by working hard and working smart. You must earn it. So yeah, what I'm saying is that you should make properly on time. and you do not waste your time. Okay? Alright, so now let's look at the topic, the first thing in our plan is what is dispensing? Let's look at the meaning of dispensing. From your, let me see what you know about the term dispensing. Whenever you hear the term, what comes to your mind? What's the name? Mariam who? Huh? Okay. Tell us. Stand up and tell us. Tell us what your understanding. Have you got through the course material? Are you in my group? Who is not?
I don't think it's either.
Did you change your number? Is it that number you chatted it up with?
Yes, sir.
And you don't know what you have. What else did you go to WhatsApp? And you don't know whether you're in the group. Continue, huh? No idea. When I hear the term this person, what comes to your mind? Hey! Leave on the side to this person to look at me and bring it home. Act of what? I agree with you. I like that. Sit down. Dispensing is what? Defined as the process of preparing and what? Giving medicine to a named patient on the basis of what? A prescription. That is when dispensing process is completed. There should be a prescription, either written, depending on the nature of the medication you are giving. There's some medication that you don't need to write, just like some like paracetamol. Maybe you have headache, the doctor will just say, so you can't talk of dispensing. As I told you that there should be prescription, right? It depends on the nature of the medicine. There's some medicine that you must have a written prescription because you need to be documented for future purposes. If there's any issue, you go to trace the prescription. Am I coming? But there are some you may come to me, or you even a doctor. Maybe you have a doctor. Maybe you say, I have headache. You say, okay. You ask you what the doctor may not be in hospital. You will just be on phone. It's okay. But buy paracetamol. All those over-the-counter medication. Buy paracetamol. Just buy paracetamol. Take it 1 tablet, 2 times or 3 times. Sorry, 2 tablets, 3 times. Is that not a prescription? Is it written? It's not the because of the nature of the paracetamol. Paracetamol is not like all these prescription. There's some drug we call prescription only drug that you must come with a word prescription. In fact, there's one that says you must collect the prescription from you and to file it, put it, and write it down in what we call poison book. When we get to that, I will explain that more. So, but the point I'm making is that there's prescription there. One. Then at the same time, complete dispensing process has to start from preparation. It starts from what? preparation. You prepare it, even though these days they prepare it from the company, package it, and distribute. But even at that, there are still some that they will prepare, compound in the dispensing lab for 1 or 2 patients waiting to take the medication. That one we call it extemporaneous what? We call it extemporaneous what? Dispensing. We discuss that when we go to what scope of what? Dispensing. So dispensing involves, of course, now, for you to be able to dispense properly, it involves correct interpretation of what? The wishes of the what? Prescriber. It involves what? Correct interpretation of the what? The wishes of the what? Prescriber. I am a prescriber. I have seen this patient. I am the one that fully know what is wrong with what the patient. But I have tracked the patient, possibly sent them to a laboratory, get a result, diagnose that this is what is wrong with this patient. And now, because I have been trying to cure that or treat that thing, and I know the drug I will prescribe for the patient. Now, when the paper comes to you as the pharmacist, you look at it. When you look at it now, you look at it now and interpret it properly. You actually interpret the prescriber's wish, what you want to achieve by prescribing it. Am I complete? If you interpret properly, you interpret, even though sometimes there may be error, but you don't need to take a decision. You go back to what the physician and have a meeting with the physician and take a decision on what to do about the patient's treatment. Am I complete? And come up with something. If there is an error, it will be corrected before you now proceed in either preparing or just dispensing what the medicine. Am I complete? Good. So that's why I said that it involves correct interpretation of the wishes of the prescriber, as well as accurate preparation and labeling of medicine for use by the patient. So it involves the accurate interpretation of the wishes of the prescriber. And even at that, in preparation, you prepare properly to avoid issues. And you also label properly so that the patient will not take the wrong dose or take it at the wrong timing. Am I communicating? Good. So where does this process take place? Where does the process of dispensing take place? Dispensing process takes place, first of all, in a PCN registered premises. In a PCN means pharmacy council of what? Nigeria. It was previously Pharmacist Council, but it was changed to what? Pharmacy Council of Nigeria. This is a body that regulates the pharmacy profession in Nigeria, both the training of pharmacists and pharmacy technicians and other pharmacy personnel, and a regulation of the practice itself. That's the body. So what am I making? This very place that dispensing should be carried out must be registered. What it means that the PCM must come and inspect the place and say that the place is in order for, it's okay for what? Dispensing purposes. And check the equipment, check the personnel, and sure that they are qualified to be able to do what? Carry out dispensing. So the place must be duly registered by what? PCM. It can be hospital. It can be hospital. It can be community pharmacy. Inside hospital, we have pharmacy inside hospital. We call it hospital pharmacy. It can be community pharmacy. Those ones you see on the road, where they say Pax Pharmacy, Alpha Pharmacy. These are we call them what? Community pharmacy. Am I completing? It can also be the pattern medicine shop. Yes. Dispensing is carried out. The two of us, those things they buy from the distributors, and the patient comes with prescription and they give maybe all these OTCs. the one that they can carry. Because PCA, if it is a pattern medicine premise, PCA must register it. Because PCA need to, there's guidelines on the type of drug that should be what, so that should be what, dispensed what, there. There are some drugs that are dispensed in pharmacy that cannot be dispensed in such what place, because those there are not qualified to handle such what medicine drugs. Am I complete? So this is why PCA will do what, regulate. You should have that place, but by registration means that they have come, first of all, and look at it and say it is okay for such what practice. So it can be what? Hospital. It can be hospital. It can be health center, even health center, primary health center. Yes. It can also be clinics, be private and government hospital. These are places where dispensing can be what? Carried out. Where dispensing can be what? Carried out. Any question? Our time has elapsed. This is your break time, right? So let me allow you to observe your break. After your break, please call your once it's 1 o'clock, call your citizenship or lecture. Let me allow you to observe your break. We'll continue from knowledge needed to be acquired by pharmacy technician to be able to do what, dispense properly. Because as a pharmacy technician, for you to dispense properly, you must have the knowledge and the skills. So we look at what and what you are expected to know before you can do what, dispense properly. That's where we'll start in our next class. Any question? Any question? Today we just came, we introduced the word, the course title, we discussed the introduction, we discussed the different market distribution, we also discussed how our conclusive assessment will be, and we also discussed we now entered discuss the meaning, division of what, dispensing, and in our next class we start from the knowledge and skills you need to be able to do what, dispense properly. Any question? Any question? So if you have said any question, we'll stop it for today. Thank you very much for your attention. See you next time. What? Group. I have my number. Collect my number and chat me up. Send me your full name. I will be giving you a red number. Send me your full name and your red number. Then chat me up so that I'll ask you.
I should do the same too.
Huh?
I should do the same. There are no way my own phone is coming from. If I know I have a number, but I don't know why I did not receive the.
Chat me up too. Alright, thank you.